Hey guys, welcome back to another today's video. In this new today's video, it's going to be a brand new political discussion based video. In this new discussion based video, it's going to be talking about the U.S.'s healthcare system and analyzing the pros and cons of the U.S. healthcare system and the other healthcare system that are used around the world that operate a little differently. I'll be analyzing the pros and cons of each, and then I'll be going into the major problems that's plaguing the United States healthcare system and what type. And at the end of the video, actually before at the end of the video, I'll be talking about where both sides stand in this issue and both sides solutions that they are proposing to make healthcare much more affordable again in this country. And at the end of the video, I'll be sharing my solutions what the U.S. should do to make healthcare much more affordable again and free for all Americans. And let's begin, shall we? If we really want to fix healthcare and fix the U.S.'s healthcare system overall and make it affordable for all Americans, we have to understand what type of healthcare system that the U.S. uses. In the U.S., with the United States, unlike Canada and the UK and other modern countries and most other developed countries, we don't have a universal healthcare program like Canada and the United Kingdom, for instance. Our healthcare coverage is provided through a combination of both private health insurance and public health coverage, which would be Medicare and Medicaid. But to go even further, the United States healthcare system is a direct fee system where patients pay directly for the services of doctors and hospitals. So in our country, the Americans pay more for healthcare than the citizens of any other country. In the year of 2010, Americans spent an average of $8,233 per person. As well, Americans spent almost $2.6 trillion for health services and medication in the year of 2010. That's even much more than the citizens of other countries. And but that's what happens when you have more of a direct fee system that the U.S. uses, where we as Americans pay directly for our health care. But then the other healthcare system that other countries use, this would be what most other developed countries use, is socialized medicine or universal healthcare, or most notably public funded healthcare, which is also referred to as, that Bernie Sanders refers to it as, Medicare for all. And in universal healthcare, the citizen, they provide all their citizens with public funded health care. It's not free, but the taxpayers, they pay for it through taxpayers, through taxes. But you have to pay more in taxes. That's kind of the trade-off of publicly funded health care. If you want free health care, your taxes you're gonna have to pay more in taxes. But there are pros and cons to each, like publicly funded health care. Like universal health care, there are pros and cons of that type of system, but there are also pros and cons towards the U.S.'s healthcare system, which is a direct fee system. And like what I said in the beginning, I'll be going into the pros and cons of the U.S.'s healthcare system, most notably, and then I will be talking about some of the solutions that are being proposed by some of these U.S. politicians to reform the U.S.'s healthcare system. So let's begin, shall we? The pros and cons of let's first talk about the pros of the U.S.'s healthcare systems in the direct fee system. The pro of using a direct fee system in healthcare is that it led to greater quality on the healthcare service, great quality of healthcare services. In the United States, we have the best mental health services in the world provided to us that we actually pay for. And the reason why and as well, hospitals all across the United States have the best modern equipment and highly qualified doctors. And you know why? Because physicians and surgeons have to go through rigorous specialty and subspecialty training. and this allows them to actually treat even the rarest conditions. And this is one of the strengths of the U.S.'s direct fees system when it comes to our healthcare, but purchasing directly paying for our healthcare system. It led to a better quality of healthcare services more and more, because we set different types of training and different types of regulations to making sure that we are giving our physicians, surgeons, and other doctors and nurses the tools and the training that they need to effectively treat the most rarest conditions, from different types of diseases, from injuries and illnesses. It allows them to actually effectively treat those type of conditions. To treat those type of conditions as well. Another advantage when it comes to the U.S.'s healthcare system is minimal waiting lists for major procedures. Americans don't have to wait in long lines to see a surgeon, to see a specialist, to see a doctor in the United States. For instance, in a study conducted by the Commonwealth Fund, in the U.S., only 23% of Americans wait longer than 4 weeks to see a specialist. That's even in Canada, 57% of Canadians wait more than 4 weeks to get an appointment with a specialist. That is a huge difference, and that's one of the advantages of a direct fee system. You're going to have you wait less. You don't have to wait that long to go see your doctor, to get the medical treatment that you need, or to get the appointment that you need with a specialist. And that's one of the strengths and that's another strength with the U.S.'s healthcare system as well. You get different types of Medicare options, and besides, in the U.S. there are many different Medicare options available that you can choose based on your preferences or the lifestyles you lead. For instance, there are special Medicare Advantage plans for people who travel often or who want extra benefits like prescription drug coverages, as well. If you enroll in a Medicare Advantage plan, your original coverage will continue being billed directly through Medicare. On the other hand, the Advantage plan will be billed through your private insurance company as well. Thanks to the U.S.'s healthcare system, we have adequate number of resources. Like in many other countries across the globe, where there are not enough medical supplies, both for the workers and the patients, the United States has adequate resources to make sure that every patient with health insurance can get the treatment that they need. So we have enough medical supplies for our healthcare workers and our patients to help our U.S. patients get the healthcare treatment that they need. But just like Medicare for all, just like publicly funded, and just like any other solution, just like any other system, it will always come with its cons. It will always come with its disadvantages. And one main disadvantage that I will be mainly talking about in this video is that healthcare services are way too expensive. And that's one of the biggest issues that Americans have with this current healthcare model, and why they want more reform to make healthcare much more affordable to them. Because some Americans don't have insurance. They're underinsured, because it's way too expensive to afford health insurance, and then they have to pay for medical costs out of their own pocket. And we all know healthcare is very expensive, and people who don't get the insurance also have very limited number of services they can get access to, and as well, and not having insurance, that can lead to a lot of medical debt. That can put a lot of medical debt in some people, and it's one of the leading causes of bankruptcy in the United States, and that's a huge problem. And as well, one thing I've learned in my life is that it's very important to always have health insurance, because if you do not have health insurance, it's gonna keep eating up your savings account, and that's a big problem. And honestly, in my opinion, everyone should have health insurance. And the government should be doing things to make health insurance a lot more affordable for all Americans, to making sure they're not paying the medical costs out of their pocket. They're always enrolled in insurance plans to cover their healthcare costs. As well, another major problem with the U.S.'s direct fee healthcare system is that is limited insurance coverage. a majority of Americans get their health insurance through their employers, like companies like such as Walmart, such as Target, such as Starbucks, and other firms, because other firms give their employers actually free healthcare benefits, and that's a major problem, because like what happens if an American in some type of event loses their job from a recession, or the business went under and they had to lay him off, or he just got terminated because they couldn't afford paying him anymore, and because the firm can't, because labor got too expensive for that firm to pay a lot of people. Well, then that person's out of work, and guess what? He doesn't. And guess what? It's impossible for him to keep continuing to pay for insurance, to keep paying for health insurance, to keep paying for his medical costs. And guess what? He can't go see a doctor anymore. If he can't pay for the medical costs, he's going to be in huge medical debt. And as well, at some point he can't go to the hospital if he has an injury anymore. And that's a big problem, because if someone has an injury, someone has a disease, they should always have the right to go to the hospital and get it checked out, because that's their right. Everyone has the right to life that's enshrined in the Declaration of Independence. As well, there's a total lack of transparency with the U.S.'s healthcare system. The U.S. lacks price transparency, for one. Well, let's see. People, for instance, people who are not able to shop around and figure out their most budget-friendly option is. Healthcare is what Americans spend most of their family budget on after their housing. Let me see. Today, only 12% of the U.S. population is opposed to price transparency in healthcare. Meanwhile, hospitals claim that the reason why prices are not transparent is that it allows them to offer discounts to insurance agencies. However, this doesn't always make sense, since the goal of each hospital is to make money as possible, to make the most money as possible. And as well, another major flaw is no preventative care. Even though our healthcare system provides one of the most best qualities, leads to, let me see, let's go back, the best quality healthcare services, physicians and surgeons that are equipped to handle any type of injury and disease, they will hardly put any emphasis on preventative care. They can treat like rare medical conditions, but they don't offer quality follow-up services. Like another major problem with the U.S.'s healthcare system is new findings confirm predictions on a physician shortage. The projected shortage of between 46,900 and 121,900 physicians by 2032. This agency, let me see, the Association of American Medical Colleges, they report a shortage of 46,900 and 121,900 physicians by 2032. And with a major factor, like with a driving demand for more doctors and physicians continues to be growing, a shortage of that is really going to drive up the healthcare costs. Because one thing I've learned in economics, when it comes to supply and demand, when the demand is so high and supply can't keep up with that high demand, the prices are going to go up because how do I put this? Because when the prices go up, because they might not have enough healthcare workers, or not enough doctors that can treat those patients, to treat those people, and that's going to be a huge problem if we don't get this addressed. And that's really one of the major problems with the U.S. healthcare system in the U.S. Not just the shortage, no preventative care, lack of transparency, limited insurance coverage, and the fact that healthcare services are very expensive. And then, and what adds on to the healthcare service being very expensive is a shortage of doctors and nurses, and that's a huge problem, because if the demand for healthcare is very high in the U.S., that could be a reason, because we have a shortage of doctors that are willing to treat patients, and that's a problem. And I will be covering this when we get to the final part of the video. I will be going over my solutions. But now let's talk about what is our politician, what are other states doing to actually make healthcare much more affordable again. So as you may know, independent Senator Bernie Sanders of Vermont is proposing a Medicare for all solution, which is pretty much a public healthcare coverage. Let me see, it should be over. Yep, it's essentially socialized medicine, universal healthcare, publicly funded healthcare for all Americans. It's paid by taxpayers. That means your taxes are going to go up. That's the trade-off of publicly funded healthcare. If you want free healthcare, your taxes are going to have to go up. You're going to have to pay more for taxes. And well, that might sound all nice and not nice, but that does come with some pros and cons here. For instance, universal healthcare lowers healthcare costs for the economy overall, since the government controls the prices of medication and medical services through regulation and negotiation. It would also eliminate the administrative cost of working with multiple private health insurers. Doctors would only have to deal with one government agency rather than multiple private insurance companies, along with Medicare and Medicaid. Companies would not have to hire staff to deal with many different health insurance companies' rules. Instead, billing procedures and coverage rules would be standardized. Hospitals and doctors would be forced to provide the same standard of service at a low cost instead of targeting wealthy clients and offering expensive services so they can get a higher profit. Universal healthcare leads to a healthier population. Studies show that preventative care lowers emergency room usage. Before Obamacare, 46% of emergency room patients were there because they had nowhere else to go. The emergency room became their primary care vision. This type of healthcare inequality is a major factor in the rising cost of medical care. And those are some of the pros of moving towards a Medicare for all system, moving towards a publicly funded healthcare system. But it also, just like the U.S.'s healthcare system currently, the direct fee system, it also comes with some negatives. Some of the negatives and disadvantages of Medicare for all or universal healthcare, some analysts are concerned that the government may not be able to use its bargaining power to drive down the cost as steeply and as quickly as Sanders predicts. Thorpe argues that Sanders is overly optimistic on this aspect of the bill. Other analysts are concerned that insulating people from cost of care will drive up usage of medical care. Drew Altman, who heads the Kaiser Family Foundation, pointed out that no other developed nation has a zero out-of-pocket cost. People may not be as careful with their health if they do not have a financial incentive to do so. And I ultimately agree with this disadvantage of Medicare for all, because if people don't have a financial incentive, they might not care too much about their health anymore. Because what's the whole point of caring about your health now if you don't have an incentive to actually manage your resources wisely? Because isn't society supposed to teach us that one thing we've learned in economics, the one basic fundamental economic problem of society is that our fundamental economic problem is scarce resources. Resources are limited. We have to manage our limited resources wisely. And if we have publicly funded healthcare, what is that going to lead to? People might not have a financial incentive. People might not have an incentive to use their resources wisely and be more careful about their health. They might not actually do all that stuff. And with that, what I ultimately mean by that, if people think they can get their healthcare free, then they might start pursuing more of a healthier, a very, very, very unhealthy lifestyle, because now they don't have to care about spending their money on cigars, on junk food and all, and unhealthy food that they're consuming in their bodies. And they're not being really careful on their health anymore, because you know what? I don't have to do that anymore. The government will take care of me. Then that's going to be a huge problem, because no one's not going to have a financial incentive to take care of their own health. Another big problem is that the government have to limit healthcare spending to keep the cost down. Doctors might have less incentives to provide quality care if they aren't well paid. Coincidentally, one of the pros with the U.S. healthcare system is quality healthcare services. We have currently we have the best mental health services than any other country in the world. And if we're going to move to a publicly funded healthcare system like Medicare for all, it's doctors might. That's going to drive down the cost. That's going to drive down the quality of healthcare overall, because doctors might have very, very, very little incentive to actually provide great quality care for all Americans. They may spend less time per patient in order to keep the costs down. They also have less. They also have less funding for new life-saving technologies. And you know what? That's important. We always need to keep having new life-saving technologies to keep finding new ways to actually save people, to actually find new technology where we can cure diseases. We can do a lot of things to produce more of a healthier society for all Americans. And the final negative of Medicare for all is, since the government focuses on providing basic and emergency healthcare, most universal healthcare systems report long wait times for elective procedures. The government may also limit services with a low probability of success and may not cover drugs for rare conditions. And the one thing, the one thing I want to get to there is it might report long wait times for elective procedures. And yet again, coincidentally, that's one of the advantages currently with the U.S. healthcare. It minimizes waiting lists for major procedures. And if we're going to move to a Medicare for all system, a universal healthcare system, that's going to encourage more long wait lines like what the people in Canada have to deal with. And that's going to be a huge problem, because if people have to wait longer and longer, some people, that could lead where we're not going to be able to that could lead to death, more deaths overall in this country, because people are not going to they might not have enough time to actually get the treatment and the health and the procedure that they need to save their life, because they might be in dire condition. And that's going to be a big problem overall, and why I just completely disagree that we should not move to an entire healthcare system. But and that's really one of the left's argument. That's what they really want. They want to completely move to a publicly funded healthcare option. They want to move to Medicare for all, where the government and where U.S. taxpayers are paying for everyone's healthcare. And that might be a good thing overall, because we're caring for everyone. Because honestly, I'm a firm believer in the Declaration of Independence. I'm a firm believer in the U.S. Constitution, that all men are created equal under God. And all men have the right to life, liberty, and to the pursuit of happiness. I'm there to preserving that ideal and fighting for that ideal, giving everyone the right to life and liberty. But there's also some negatives, and we should still be preserving somewhat of that market-based healthcare type of system in our country, because I don't think moving towards just government-run healthcare is going to solve. It might solve a little bit, because it might put more and more people. It might allow more people to have access to high-quality healthcare, but I think you still need that market-based healthcare, so the people that do have their private insurance can still keep their private insurance. But not to get off topic here, let's go into the Republicans' argument of healthcare. Let me see. That's not what I want. Here we go. So the Republicans' plan on healthcare is essentially not giving more power to the government, but by giving power back to the states and the individual. And the one thing that therefore, let me see if I can find it. The plan. This increased flexibility the RSC plan provides to the states is similar to what the Trump administration has done by expanding the use of Section 1332 state innovation waivers, which is found in the Patient Protection and Affordable Care, ACA, or also known as Obamacare. States have been using these waivers to lower premiums. So the Republicans want to give power back to the states and the individual, allow them design their own like healthcare systems overall, and that's actually a pretty not a bad idea. And with these state waivers, let me see. They use them to develop creative alternatives for individuals who would otherwise require care in a nursing facility or hospital. And moving towards letting the states to develop their own healthcare system is not entirely a bad thing. It it strongly supports the founders' ideal of federalism. That's every state is their own all states are individual sovereigns. I have to completely agree with Republicans on this one. States are much more competent at designing their own healthcare systems, to building their own bridges, building their own infrastructure. Let the state, let the federal government give them the funding necessary to design their own healthcare systems the way they choose. California, my home state of California, they can move towards a more of a Medicare for all type healthcare system. Texas can still preserves that mixture of a publicly funded and private healthcare system, where they will still have Medicaid and Medicare, but they will also have other health insurance. But the Republicans are, let me see, yep. Oh, God damn it. Sorry about that. There you go. Let me see. Let me go back to that. Let me and once again, the Republicans, the largest conservative caucus in the Republican Party, just want to give more power back to the states and the individual. They're more for that free market approach, all about competition. And I used to be like during the start of 2017, I used to be I'm kind of still a firm believer in the free market and promoting more competition in the medical industry, because when you have way more competition, it'll help drive down the cost of health insurance, because when you have more and more companies all competing, that will raise the quality of healthcare and consumers will be better off overall. It will work in any industry, like the video game industry. When you have more companies competing, it will help drive down the cost of goods and services and raise the quality of goods and services. That is the same logic with healthcare overall. When you include competition, that is then that's what the Republicans are there for. Like people like Trump, they want to allow Americans to buy their health insurance across state lines. I'm completely for that. I think that's an excellent idea. Just allowing more competition and getting that will help drive down the cost of health insurance and raise the quality of healthcare, because when people are competing, it will keep raising the quality bar of health insurance as well. Let me see if I can find it. Yep. I wanted to go into this before I talk about my solutions on how we can make healthcare much more affordable again in the U.S. This is something I really wanted to talk about, because I never knew this before. It looks like there's actually some both sides on this issue. Should all Americans have the right to be entitled to health care? And there are pros and cons to each of them. The pro side, I would say this is more of the liberal argument to say the founding documents of the United States provide support for the right to health care. The Declaration of Independence states that all men have unalienable rights, that among these are life, liberty, and the pursuit of happiness, which necessarily entails having the health care needed to preserve life and the pursuit of happiness. The purpose of the U.S. Constitution, as stated in the preamble, is to promote the general welfare of the people. According to former Congressman Dennis Kunich, as part of the efforts to promote general welfare, healthcare is a legitimate function of government. But the negative with this, the counter argument is the founding documents of the United States do not provide support for a right to health care. Nowhere in the Declaration of Independence does it say there is a right to health care. The purpose of the U.S. Constitution, as stated, is the preamble is to promote the general welfare, not to provide it. The Bill of Rights lists a number of personal freedoms that the government infringes upon, not material goods and services that the government must provide. According to former Congressman Ron Paul of Texas, you have a right to your life, and you have a right to your liberty, and you have a right to keep what you earn in a free country. You do not have the right to service or things. The second argument is instituting that some people say why healthcare should be a right for all people. Instituting a right to healthcare could lower the cost of healthcare in the United States. According to the study from the University of Massachusetts at Ymcas, under a single-payer system in which all citizens are guaranteed a right to healthcare, total public and private healthcare spending could be lowered by up to $1.8 trillion over the next 10 years due to lowered administrative and prescription drug costs. The American Medical Association reports that private health insurance spends 11.7% of premiums on administrative costs versus 6.3% spent by health programs. According to data by the Organization for Economic Cooperation and Organization for Economic Cooperation and Development, Canada and the United States, two countries that provide universal health coverage, spends 47% and 42% of what the United States did per capita in 2017. As well, the second continent's right to health care could increase the U.S. debt and deficit. Spending on Medicare and Medicaid and children's health care insurance, all government programs that provide a right to health care for certain segments of the population, total less than 10% of the federal budget in 1985, but by 2012, these programs took up 21% of the federal budget and are predicted to reach 30% of federal spending by 2028. According to former U.S. House Budget Committee Chairman Paul Ryan, government healthcare programs drive the explosive growth in our spending and our debt. Research from George Mason University concludes that providing government-funded healthcare to all could increase federal spending by $32.6 trillion over the first 10 years of implementation. The Committee for Responsible Federal Budget calculates that universal healthcare coverage would result in an additional $19 trillion of federal debt, causing debt to rise from 74% of GDP in 2015 to 154% of GDP by 2026. And this is some of the pros and cons, and I will post all these sources that I found. I will link them in the description below so you guys can check them out for yourself as well, so you guys can understand where both sides are coming from on this issue, and you guys might consider that if you guys are going to support Medicare for all, you guys might have a change of heart a little bit and say, maybe Medicare for all is not entirely just a good idea. Maybe we can like provide a mixture of that, and we can provide more of a mixture of publicly funded and private healthcare. And that's what I'm for. I'm for that. That's what I'm completely for. I believe that there are some goods with capitalism and socialism. I'm more for a mixed economy. I'm more for a mixture of public health care and private health care, and that's what the American Liberty Affordable Health Care Act will do. It's there to mix the private and public health care overall to ensure that to make sure all Americans are covered with great high quality health care, but as well to preserve competition in the private sector, and to preserve the competition in the private insurance of healthcare in the private sector, and to allow wide range of new choices in the healthcare industry. So the American Liberty Affordable Healthcare Act. Let's go into detail. This is the part of the video where I'll be listing out my solutions on how we can make healthcare much more affordable and free for all Americans, that will reimagine the promise of America for generations to come. And in the summary of this Healthcare Act, the American Liberty Affordable Healthcare Act plan is simple: to reduce the cost of healthcare for the American people. It protects all people to getting the high quality healthcare that they need, while also still preserving the market approach to healthcare that still promotes competition in the medical industry, that will keep lowering the price and raising the quality of healthcare as a whole. The one ideal principle that the American Liberty Affordable Healthcare Act will provide is that it will allow state-run healthcare. Each of the 50 states and future states, I'm talking to you, the District of Columbia and Puerto Rico, will receive funding by the federal government to design their own healthcare systems. But with this new law, it cannot discriminate and take someone's right to getting the high quality healthcare that they deserve, because there will be laws in this act where states cannot discriminate anyone that has a pre-existing condition, that has or a chronic condition. They cannot discriminate or take away someone's right of getting the medical treatment that they need and deserve. As well, American citizens are allowed to, in this law, American citizens are allowed to buy their health insurance across state lines. Insurance firms are allowed to compete and sell their insurance plans across state lines. And this backs up my other point. Just allow more competition, far more competition in the healthcare industry. If we have many healthcare firms in the United States, and there's much more competition, and you're giving the American citizens far more choice in the medical industry, guess what? That's going to drive down the cost of health insurance and raise the quality of healthcare overall in this country. And as well, another thing it's going to propose a mandate on physicians, nurses, surgeons, and doctors to put an emphasis also on preventative care, which is essentially disease prevention. Another major thing that the American Liberty Affordable Health Care Act will propose. This is something what the Democrats support. A public health option. People who cannot afford health insurance, or that had health insurance in the past from an employer, but when they got fired or lost their job, they lost their health insurance and are forced to pay for the healthcare out of pocket, will actually be publicly opted into Medicare and Medicaid, and they will be automatically enrolled, so there is no need for them to apply for Medicaid and Medicare. This is to ensure that everyone has access to healthcare. Everyone has access to in insurance. Some people might have a private health insurance. Some people might have an insurance that is paid for by the federal government or by the state government. But it's there to provide. This law is there to provide everyone access to health insurance, to making sure no one is getting left behind, because everyone has the right to life and liberty that is enshrined in the Declaration of Independence. As well, but people that do have their private insurance, like what I just said, will keep their insurance plans and doctors. If they like it, they'll still keep it in this act, because I'm all about protecting private health insurance and still keeping healthcare in the private sector. But it's all about combining the goods of socialism and the goods of capitalism and bringing all the positives together to create something truly special that will create a more perfect union for all Americans. And as well, this is also going to lead to a Medicaid and Medicare expansion. People with pre-existing conditions, senior citizens, people with chronic conditions, poor people that live on welfare and food stamps, physicians, nurses, surgeons, and doctors will be all eligible for Medicaid. And I'll get to my point why physicians, nurses, surgeons, and doctors will be eligible. I'll get to the point later in a later slide. And the people that meet these eligibility requirements of Medicaid and Medicare shall not be denied of getting the health care that they need. So regardless of what state they live in, they cannot be denied of getting the health care that they need and deserve, getting the treatment that they deserve. As well, one thing that we will preserve part of the Affordable Care Act, young people will still be able to remain on their parents' health insurance plan until age 26. As well, this is something that Democrats support. This still funds Planned Parenthood. This law will still protect a woman's most fundamental right of getting an abortion, and no person shall deny a woman's right of getting an abortion. I'm all for protecting everyone's right. Everyone, regardless of what gender you are, regardless of the color of your skin, regardless of who you are in this country, you all have the liberty to choose a life that you want. So if a woman want to get an abortion and they don't want to have kids, they have that right. They have the right to get an abortion, and no person shall deny that woman's right. But I also do agree with conservatives on this argument. And the one area I will agree with conservatives on is late-term abortions. I'm all for permanently banning late-term abortions. I am not for that, because you're essentially killing an unborn baby you're essentially killing an unborn baby at a late stage, and that's wrong. That's immoral. I'm all for a woman getting an abortion, but I'm not for them getting an abortion during the late term of pregnancy. As well, this is all about, yet again, back to my argument of competition in the healthcare industry. breaking up the big pharmaceutical companies, break them up into smaller healthcare firms. This is something that Teddy Roosevelt believed in. He believed in more competition. He believed in breaking up big business, promoting more competition in the medical industry. I'm all about that. I love competition, because in my opinion, with more and more competition in the private sector, the customers, the American consumers will be better off overall. Because with competition, with more and more competition in the health industry, that will drive down the cost of healthcare drastically and raise the quality of healthcare overall. As well, it gives the American people a wide range of different healthcare and insurance companies of their choosing, that's based entirely on the preference. So once again, more and more competition. It's all about competition that will provide more choices, but as well, more and more companies will be competing to lower the cost of health insurance and raise the quality of healthcare overall, to keep quality at a very, very high level, which is a good thing, because you want the best medical service. You want our medical service to be at the best quality ever, because they can treat more patients. They can treat more patients with different types of medical conditions. They will be better prepared, and you're going to get better doctors. People will be willing to perform procedures for much longer, so they can save people's lives. When you save more people's lives, you're changing people's lives. You're making our world a better place for all Americans. And as well, subsidies and sales incentives. And what I mean by this, like earlier in the video, just like what I said about supply and demand, to be able to meet the high demand of healthcare costs that will ultimately drive down and how we can drive down it is providing more incentives to people to incentivize more people to actually work in the health industry. And this is where tax credits and benefits come in. What I mean by benefits is that physicians, people who nurses, surgeons, and other doctors that work in the healthcare industry, they will be eligible for Medicaid. This will be there to incentivize more people to join the healthcare industry, to pursue a career as a doctor, to help increase the supply and meet that high demand of healthcare. And you know what? When we can bring the supply and demand back to equilibrium level, we can lower the cost of health insurance overall. That will and when we do that, we will incentivize more people to work in the healthcare industry. When you have a greater supply and have a surplus, the cost of health insurance will go down, and the demand of health insurance will still be high, but we will have more doctors to provide for patients. We will have more doctors to actually provide for those patients, to help to treat those patients. And when we incentivize more people to become doctors, it will help increase the supply of our labor, increase the supply of the medical equipment to treat any injury or disease, and we're saving life. And ultimately, when we are increasing the supply of how many doctors and physicians we have, we are truly saving more people's lives. We're changing families' lives, and we're making this world a better place for everyone. And as well, I know this may not be for healthcare wise. I know this might not do anything about driving the costs, but in this law, it's all about. This law will also include subsidizing on YMCAs and fitness centers, and this is there to give more people an incentive to pursue a more healthy lifestyle for themselves. And when this goes back to my point with financial incentives, when people have a financial incentive to actually pursue a healthy lifestyle, they will do it. And guess what? One thing I've learned in economics so far, because I am in college right now, taking an economics class, I learned about externalities, which is essentially the uncompensated impact of one person's actions on the well-being of a bystander in the presence public policy can improve efficiency. And the one thing I've learned is, if you have more positive externalities, the impact of the bystander is beneficial to all people in society. So if we're subsidizing on YMCAs and fitness centers and giving more people an incentive to pursue a more healthy lifestyle for themselves, like working out, eating healthy more, we are then giving them a financial incentive to actually pursue more of a healthy lifestyle. And that's a good thing for society, because it's benefiting everyone because it's a good thing, and we're going to increase life expectancy for that. Oh my God, I can't pronounce the words right now, but that's a good thing, and we need more of that, and we need to decrease that negative externality that has a negative impact that's not really that's not beneficial to society. We need more positive externalities we need more and more people to pursue a healthy lifestyle, and then with taxes and sin taxes, and this goes back to positive externalities with sin taxes, more of a taxes on the bad stuff, like the sugary chemical drinks, the tobacco, the flavored tobacco, marijuana, cannabis, alcoholic beverages, fast food, junk candy, and other junk food. They will all be taxed. They will all be taxed. And that will help discourage people from buying those type of things. It will help discourage people, and they will consume less of that in their body. It will discourage people and pursue more of a healthier lifestyle for themselves. They will go more to the fitness center. They'll go more to the YMCA, their local YMCAs, local fitness centers. They will eat more healthier, and that's a good thing for society. And as well, and part of this law to making sure we will pay for all these services for people to make sure everyone is covered with health insurance. That raises taxes on the wealthy and the billion-dollar corporations, and then they will be paying a big chunk of a lot of these a lot of these policies that I'm proposing in this bill, in the American Liberty Affordable Health Care Act, to make healthcare much more affordable and free for all Americans, but while also preserving the private sector, preserving private healthcare for all Americans. But this overall bill, all about living up to our founders' ideals of everyone has the right to life and liberty, whether it is promoting more of a positive externality on whether it's providing more of a positive externality, giving more financial incentives for people to actually pursue a healthier lifestyle, or subsidizing more on giving more people an incentive to actually for people to work in the health and care industry to help increase the supply to meet the high demand of healthcare in this country. That will increase the supply of labor, where we have more doctors and physicians, nurses and surgeons and other doctors to treat any injury or disease, to actually work with patients. We will have more doctors to treat more patients, and which will lower the cost of health care. If it is breaking up the big pharmaceutical companies, that breaks where we will give more Americans wide range of different healthcare and insurance companies of their choosing that will be based entirely on their preference. That will ultimately lead to much more competition, where these many healthcare firms or insurance firms will all compete. And you know what? It's going to drive down. It's going to drive down the prices of healthcare. It's going to raise the quality of healthcare in the medical industry. It's going to protect woman's most fundamental right of getting an abortion, while also promoting the right to life, banning late-term abortions, Medicaid and Medicare expansion, people who are pre-existing conditions, senior citizens, people with chronic conditions, poor people, physicians, nurses, surgeons, and other doctors. No one will be denied the right of getting the high quality healthcare that they need in this country. And if it is young people, no American will ever be denied the right to getting healthcare, getting high quality healthcare in this country. If it is a public health option, if it's preserving private health insurance, state-run healthcare, giving states the individual right to design their own healthcare system, design their own healthcare laws, with figuring out what healthcare system works better in their state. But overall, to sum it all up, the American Liberty Affordable Health Care Act is the act that this country needs to reduce the cost of healthcare for all Americans, to provide everyone high quality healthcare that they need, while also still preserving the market approach to healthcare that still promotes competition in the medical industry, that will ultimately keep lowering prices and raising the quality as a whole, raising the quality of healthcare as a whole. Let me hear where you guys stand on this argument of healthcare. Do you guys agree with me? Do you guys agree with my solutions on healthcare? Do you think it will help And would you guys support the American Liberty Affordable Health Care Act? Do you think it's a good step to actually making healthcare much more affordable again? Do you think it's better than, do you think I changed your guys' minds on Medicare for all? Do you guys agree with me that we should mix the goods with publicly funded healthcare and private healthcare? Just share your thoughts in the comment section below. Where do you guys stand on this issue? How do you think we can make healthcare much more affordable again in this country? Tell me your reason in the comment section below. But don't forget to like and subscribe. And until next time, guys, this is the Young Centrist, and I am out.